Now you notice I didn't talk about minerals. Minerals are a different concept. Minerals cannot be manufactured by plants, as we've already said. And as a result, you have to consciously supplement with minerals. You can get some vitamins. You can get some vitamin A and beta-carotene and vitamin C and vitamin E from your grains, vegetables, fruits, and nuts, but you cannot get minerals. You cannot guarantee you're going to get minerals, so you must supplement with minerals for this reason. How important are minerals? Well, they're used as cofactors for vitamins. You cannot use vitamins without mineral cofactors. You cannot use enzymes. You cannot use hormones. You cannot use DNA, RNA, chromosomes. You cannot even use oxygen without mineral cofactors. That's how important they are. Secondly, minerals do not occur in a uniform blanket around the crust of the earth. Minerals occur in veins like chocolate ripple ice cream. And you know that chocolate ripple ice cream is 99% vanilla, and it's just 1% chocolate. And here's our problem. Plants cannot manufacture minerals. Minerals do not occur in a uniform blanket around the crust of the earth. They make up 2/3 of the 90 essential nutrients. 60 minerals out of 90 nutrients, 2/3 of the 90 essential nutrients are minerals. That's how important they are. Now, one of the things that cause problems, in addition to plants not being able to manufacture minerals and minerals not occurring in a uniform blanket around the crust of the earth, is that we've used a simple fertilizer for the last 100 years in the United States called NPK, nitrogen, phosphorus, potassium. And the simple fertilizer gave the farmers the maximum yield in terms of tons and bushels per acre. Nobody gave a farmer any kind of tax break or cash incentive to make sure that you and I got all 60 essential minerals. That's our own responsibility. Farmers grew tons and bushels. Now, one of the things I want you to pick up, one of the things I want you to get, is a copy of U.S. Senate Document 264. U.S. Senate Document 264 says that there's no longer any nutritional minerals left in our farm and range soils, and as a result, the grains, vegetables, fruits, and nuts that are grown there are minerally deficient, and as a result, the animals and people who eat these minerally deficient grains, vegetables, fruits, and nuts get mineral deficiency diseases, and the only way to prevent and cure them is with mineral supplementation. Now, to me, the scary thing about U.S. Senate Document 264 is that it was written and published in 1936. 1936. And at that time, we began to put vitamins and minerals and trace minerals into animal feeds to make up the difference. And, of course, since that time, we've been able to prevent and cure all kinds of diseases in animals with these nutritional formulas. Unfortunately for human beings, we got wonder drugs in 1936. We got sulfa drugs in 36. We got penicillin in 38. And we got cortisone in 42. And it was very easy for the medical profession to con the American public into believing they would find a wonder drug to fix everything. If we just gave them enough money for research, and if we faithfully watched Dr. Marcus Welby, MD, that they would find a wonder drug to fix everything. Well, you don't believe that anymore. That's why you're here, because you don't believe this anymore. You cannot get everything you need from your four food groups, and you must supplement with your vitamins and your minerals. There are 5 early warning symptoms that even a 5-year-old can recognize when you have mineral deficiencies that are dangerous and life-threatening. Number 1 is white, gray, and silver hair. White, gray, and silver hair indicates a copper deficiency because copper is required to manufacture hair pigment. It doesn't matter if your hair color, if your original hair color is blonde or red or brown or black. Copper is required as a cofactor to manufacture this hair color. So if you have white, gray, or silver hair, you actually have a copper deficiency. Now, if this was just a cosmetic problem, it'd be no worry, but there are more sinister things going on when you have a copper deficiency. Copper is also required as a cofactor to manufacture the elastic fibers in your body, including the elastic fibers in veins and arteries. When you get a breakdown of the elastic fibers in veins, you get spider veins and varicose veins, which can result in certainly discomfort. But also, you get a breakdown of the elastic fibers in veins. You begin to get a twisting and turning of the veins, so you're at high risk of getting a thrombosis or a blood clot, which can go to your lungs, cause pulmonary embolism or stroke. Then if you get a breakdown of the elastic fibers in your arteries, you get a balloon in that area of weakened wall, of the weakened arterial wall, and this is called an aneurysm. And if it's in a strategic location, like in your head or a coronary artery, and it ruptures, you will bleed to death in seconds, or you can get a stroke from that type of bleeding in the skull. This is due to a copper deficiency. Now, the nice thing about this is if you supplement with colloidal and chelated copper, the hair color will begin to come back, and it always comes back first at the nape of the neck, comes back over the top of the head, then the sides of the head. You're going to look like a pinto pony for a couple of months while this regrowth of hair color is going to take place. But when you see this hair color coming back on the outside, you know that the elastic fibers are healing on the inside in your veins and your arteries. Secondly, there's the liver spots or age spots in the back of your hands, your face, and your neck. And these liver spots, if you have 5 of them on the outside, you actually have millions of them in your brain, your eyes, your thyroid gland, your lungs, your heart, your liver, your kidneys, your bone marrow. And these are actually rancid fat. They're called trans fatty acids. They're called ceroid is a technical name, C-E-R-O-I-D, ceroid lipofusin. These are trans fatty acids. They're free radicals. They increase your risk of cancer and heart disease many, many hundreds of %. If you actually have an eyelid twitch, if you have a toe cramp, foot cramp, leg cramp, if you have spasms of the large muscle groups in your back, this indicates a calcium deficiency. And if you have a calcium deficiency, you don't want to wait until, of course, you have something tragic happen, like compression fractures or a fracture of your hip or your leg, which can be life-threatening. You want to supplement with calcium in the most quick way you can do it. And, of course, you want to do this as colloidal and chelated calcium, so you can rebuild those bones. And this is extremely important. Don't miss these signals. You could be 15 years old and have an eyelid twitch. Your body's telling you that you have a calcium deficiency. If you have low blood sugar, narcolepsy, or hyperinsulinemia, if you have diabetes, if you have adult onset type 2 diabetes, this indicates that you have a chromium and vanadium deficiency. And if you supplement with chelated and colloidal chromium and vanadium, it'll take about 4 to 6 months for your low blood sugar, your narcolepsy, and your hyperinsulinemia to stabilize. And in a period of a couple of months, you should be able to significantly reduce the amount of either insulin or oral medication you're taking for your adult onset and type 2 diabetes.